ready to build resiliency, create a healthy lifestyle, and overcome adversity with a warrior mindset. This is Define the Fight with Mariah Prussia.
Hey, welcome back on this fine Monday morning. I mean, it is warm outside, and you know what? It's going to get even hotter in here because we have Dr. Nickie Lovat back from Firefly Medical, who has her MD and PhD in pharmacology and therapeutics, and she also has a special interest in hormones and insulin resistance. Now, last time that we had Dr. Lovat on the show, we dove into hormones and cholesterol. We spoke about a lot of different components, and it's very important for people to understand, to do a lot of research when it comes to health. And today we're going to talk more in regards to supplementation, because we know that is a hot topic for a lot of people, but also raises a lot of questions on what should and what I shouldn't be taking. So welcome to the show.
Thanks. I'm happy to be here again.
I'm excited to have you. I love the fact that you are a wealth of knowledge, but not only that, you really want to make sure that you're educating individuals on, holistic practices too. So sometimes we see the term, MD or doctor or whatever that looks like. And there's some people that gravitate towards that. And then there's also some people that shift away. So I'm glad that you look at multiple approaches when it comes to complete health and wellness.
And absolutely, if you look back to the origins of medicine and biochemistry, all of the supplementation that's required for the human body to function optimally, it comes back down to the biochemistry. What components are in those chemical reactions to make them function the best? And so, in my opinion, mainstream or conventional medicine should be more focused on supplementation than they are.
Oh, 100%, because now what you find is there's such a big push in regards to prescription. We talk about this, or we've spoken about this before. You look at the ads, it's bright, colorful, it's vibrant. I'm like, oh my God. People start placing themselves into those character roles on, if I take this, I'm going to be dancing again. I'm going to be wearing orange or whatever, but they're not listening to the undertones in regards to the adverse effects. So I'm a firm believer in regards to making sure that you are taking more of a complete product that is, whether it's from Mother Nature or, versus the other where it's more synthetically made. So, let's talk about supplements. Let's talk about vitamins. And what are some of the common myths that you have come across when people are like, oh, well, I was told to take this and this does this. So what does that look like in your world?
So I think there's a large group of people that think that if you eat a balanced, organic, whole foods diet, that you can get every vitamin and mineral that you need in your body. Now, over the last several decades, the quality of our food has gone down. It doesn't contain as much of the essential supplements and minerals inside the actual food than it used to. And we also have a lot of people who have inflammation and poor gut health. So even if you ate the perfect beef, are you absorbing everything that you need to absorb from it? So that's one of the big things I run into, is that even if you're eating well, there's usually room for some supplementation for some essential vitamins.
Especially as we start aging too, right? Because, when we look at when we're younger, we're a little bit more vibrant. You get where I'm going. And then as we start aging, we start losing different things as well, where whether you're excreting it or you're just not absorbing it the way that you used to when you were like 5.
Correct. And also it depends on your life stage and what your demands for those vitamins are. For example, women, when they're having menstrual cycles and pregnancy, they have a much higher demand for things like iron than if you looked at a 75-year-old man who doesn't have any GI bleeding or sources of iron loss in his life.
So what do you notice in regards to, so we look at the health and wellness industry. It's a scary animal. It's a very big animal where right now people are fighting tooth and nail because they're making a lot of money, right? So we talk about pharmaceutical, but let's also circle back to the health and wellness, the fitness industry too, where it's like, oh, buy this at GNC, buy this, buy that. And the reality is people need to look a little bit deeper in regards to what are the true ingredients that are found in those, because some things are absorbable, some aren't, and whatever we don't typically absorb, we're going to excrete, and you're going to see some bright yellow urine if your body's not taking it in.
Well, the supplement industry itself is not regulated. So I can open up an Amazon shop tomorrow, buy capsules, put baking powder in them, and sell it as any vitamin I want. And it's up to the consumer to know that that's not a legitimate vitamin. And that probably applies to about 90% of the supplements that are available in our country. So that means you could be on a vitamin D that doesn't actually have any vitamin D in it and think you're getting the protection and the benefits. And it's not a failure of that particular supplement, it's a failure of the quality of the supplement.
Or where it's
coming from. So, and in my experience, we use certain supplements that I know are pharmaceutical grade and are lab tested, and I also measure blood levels in my patients. So if I put them on my vitamin D and their blood level doesn't go up, they're not taking it, or they have an absorption problem. It's not a quality problem.
Gotcha. So, when you're looking at certain things aren't tested, people can just put things together. That also falls into play too, like CBD. You don't know or understand the quality of the CBD. So just because somebody slaps something on the label doesn't mean that it's the best quality for you.
And there's another factor too, is toxins. So supplements are something you're going to put into your diet every single day. If they have heavy metals in them, that's a problem because you're taking in heavy metals every day. And I hear there's a case right now with creatine supplement that had heavy metals put into it. And so you have to be very careful too that they're also toxin free and that you're not contaminating your body with another form of inflammation or something you have to get rid of.
So what are some of the key things that people should look at when they're looking at a label? And I know it all depends on what vitamin, if they're looking at B, if they're looking at C, D, so on and so forth. What are some key things for them to be aware of?
It's a really hard question to answer because there's so many different...
It's broad.
It's very broad. So with vitamin D broadly, you want it with K2. You want it a combination with K2 so that it ends up in your bones.
Okay.
With B vitamins, you want the natural form of all B vitamins. So methylated B12, methylated folate, not cyanocobalamin, which is a cyanide containing B12, or folic acid, which is a synthetic folate, which is in all fortified foods. So you're wanting to take the premium, most natural form of the vitamin rather than using a waste product. So for example, if you see fiber supplements, a lot of them contain wood chips. I don't want to be eating wood chips soaked in whatever chemicals that wood was treated with.
Right.
But if you don't know any better, that's what you're going to get.
Well, same with when you look at calcium. I know this is a commonly asked question as well. Do you take calcium citrate, carbonate, so on and so forth? What is better for the body to make sure that it's breaking it down and that you're actually receiving it?
Right. So calcium carbonate likes to be in an acidic environment. So it's the one that's best eaten with food because you'll create an acid surge to digest your food. And it will be impaired in its absorption if you're on an acid blocking medication, which a lot of Americans take H2 blockers or PPIs for their heartburn.
Gotcha.
So they won't absorb calcium carbonate very well. Whereas the other version of calcium, you can take it any time of day.
Okay.
Now, unfortunately, calcium and iron, both of those, they can affect the absorption of other drugs and vitamins themselves. So you can't take them at the same time as certain medications like thyroid medication. And so although they're best done throughout the day, you kind of have to tailor it around what you're on pharmaceutical wise.
So when you look at from a calcium perspective or a vitamin perspective, you hear, oh, it's best to take them in the morning, but you also hear it's best to take them at night because now you're not moving and your body is going to absorb those throughout the night. What, in your professional opinion, do you feel is the best time or ideal time for an individual to take their supplementation?
So I usually have a rule: if it competes for absorption with other drugs and vitamins, you should take it at bedtime. If it's something that is going to give you energy, you might want to take it in the morning. So a lot of the B vitamins tend to make people feel more energetic, vitamin D. And then there's also some supplements that are technically hormones that are over the counter, like DHEA and pregnenolone. Yep. Those tend to improve energy levels and cognitive function. So we generally recommend those to be taken in the morning when you're busiest. Obviously, if you're a night shift worker, you take them when you're busiest at night.
Yeah, you don't want to be ready to crank things up when you're ready to go to bed, right?
Exactly.
You want to make sure that you're shutting it down. We're going to go into a quick break, but when we come back, I want to talk about how an individual should be breaking down what they should be taking versus what they shouldn't be taking when we come back on Define the Fight. Hey, welcome back to Define the Fight. We are here with Dr. Lovat from Firefly Medical. And I tell you what, she is actually my provider, so I have come to know her very well after our last time being on the show here. You are an unbelievable individual. You speak the truth. You're very direct and understanding with the people that you're working with, so I appreciate that. And having you back on the show, I think it's important for your wealth of knowledge to be shared. You know, working in the health and wellness industry with personal training clients, there's a lot of different questions that come into play. And one of the main ones are vitamins. So when you look at the average individual, okay, so I know everything varies depending on demographics, age, where are you at in your life, but what do most individuals lack when it comes to vitamins and minerals within their own body?
So I actually think people are very deficient in salt. So the average person is drinking a lot of fluids with sugar in it. They have insulin resistance. They have inflammation, but they don't actually have good quality salt. All the salt they consume is processed salt, sodium chloride. So a lot of patients actually benefit from taking like a whole earth salt, like a Celtic sea salt in water. First thing in the morning, helps lower your cortisol, makes you feel good, gives you enough salt to run your muscles properly. That's a really easy one that most people could do.
So is it true in regards to when you look at like table salt, all of those different salts that they're radiized, or like, you know, the radiation
Iodized.
Iodized, that they're...
It's not radiation, it's actually iodine supplementation.
Okay.
So back in the day, patients used to develop huge goiters on their thyroid.
Yep.
And also had really high levels of congenital hypothyroidism, babies born without a functioning thyroid, or developed hypothyroidism from an iodine deficiency. And so their fix in the 70s, they took iodine out of the flour and put it into the salt.
Wow.
For goiter.
Okay.
But it's only enough to prevent goiter. It's not enough to actually make your thyroid healthy.
Okay. Interesting. You know, I know that was one of the things that was brought to my attention. I'm like, okay, you know, and I take that Celtic, the salt too, as well.
Yeah.
And I was a huge person, especially when I was fighting, is I noticed that my weight would go up when I would take salt, right? I would retain water. So at that point, if I was to have chips back in the day, I literally washed off my chips and I would eat my chips. That's how anti-salt I was, because of recognizing the retention within my own system when I was training intensely.
Right. And if you had been having a whole earth salt instead of the processed salt that was on those potato chips, you might have had a different result.
Well, and there we go. So what are some other things? So you talk about salt. What other deficiencies do you find, especially in the United States, are very common?
I would say in my patient population, 95% of people are vitamin D deficient or below normal range, under 30.
Okay.
And even patients that I treat in other states, Florida, Virginia, places that are nicer and warmer where they spend more time outside. And most people, without doing any blood work, could take at least 2,000 units of vitamin D a day. But in my experience, interventionally giving vitamin D and then measuring levels around here and in my deficient patients, they need like 5,000 or 10,000 units a day.
Now, there's some vitamins and minerals, too, where there is a cap, right, in regards to the daily intake. What are some of those that you would say, okay, hold on, just make sure that you're not going in excess? Because sometimes people think, oh, well, if I take more, I'm going to feel better.
Mm-hmm. So the recommended daily intake numbers for most supplements are not evidence-based.
Okay, good to know.
Or they're to prevent a disease. So the vitamin D recommendation is to prevent rickets in babies. So it's just enough vitamin D so that the baby's skeletal system doesn't become malformed in the womb.
Okay.
It's not enough to help you lower your risk of cancer or viral illnesses or diabetes. And so when you look at the RDIs, it depends on which supplement. So for example, the daily intake recommended of B12, you can exceed that, especially if you have like an autoimmune disease like Hashimoto's, where you have an inflamed stomach and you can't absorb it as well. Or you have maybe a pregnancy and you're on a drug that lowers your folate levels, you might take well above the recommended daily intake for folate.
Gotcha. Now, I know another supplement that a lot of people ask about is magnesium. So there's a lot of different types, and it's like, so should I take this one versus that? What are your recommendations? Or let's break down magnesium for a second here.
So I will speak pretty broadly. So magnesium, the magnesium glycinates, they can be bisglycinate. There's different versions. If you see glycinate in the word, those tend to be the one that you would take at bedtime that could help improve your sleep. It also helps lower blood sugars in diabetics, and most diabetics are deficient in magnesium.
Okay.
And it can also help with some of the biochemical pathways that support hormones, in thyroid in particular. And so the other magnesiums, like magnesium citrate, tend to be used for constipation. So those ones will be more likely to give you looser bowel movements if that's your goal.
Okay. And do you find that a lot of people actually, their bowels, right? So when we talk about constipation, does it actually relieve in most people? Or if the magnesium isn't working, what would be a recommendation in regards to, is there something that you add with it, or is there another one that you would shift to?
In my experience, constipation in my patient population tends to be related to their thyroid function not being adequate. Because it's usually not isolated. It's usually with brain fog, fatigue, cold intolerance. And that constipation reverses very quickly with optimizing your thyroid function. If it's for another purpose, let's say, and my endometriosis patients can have constipation from having menstrual blood on their gut that's causing the gut not to function properly. And that will get better actually with progesterone.
Okay.
Otherwise, if it's just you're low in magnesium or your diet is high in processed food and you're getting constipated from that, magnesium would be a good addition, like the magnesium citrate or something like that.
So another question is when we look at fish oil. Now that's a really broad one, but when we look at our omegas, there's a lot of people clearly too that are also deficient. But then when it comes down to the quality, there's a lot of low quality products that are out there on the market. So, prime example, if you're going to Walmart or if you're going to other places, you're probably not going to find high quality supplementation.
Just like cooking oil.
Right.
If you have a high quality cooking oil, it's going to be a premium price because that cooking oil has been CO2 extracted or expeller pressed, i.e. not using chemicals to purify it. So the problem with most fish oil available, like in any grocery store you'll find, or even pharmacies, it's chemically extracted oil. So they've used some kind of freak science experiment to get the oil out, and that oxidizes the oil and then makes that oil inflammatory. And that does the opposite of what the fish oil is supposed to do. And so if you have a clean fish oil that's been CO2 extracted or expeller pressed, then you're going to get the benefits.
So when people burp up the fish taste, okay, I'm going to throw that out there. I know that we had done some different testing, and we had a nutritional coach back when I was in my early 20s. She had said freeze your fish oil to prevent from that burping, so on and so forth, that taste. But she also said if your fish oil doesn't freeze over X amount of time frame, that it's a higher quality grade. Is that correct?
I'd have to look that up because usually it would depend on like the type of lipid at its freezing point.
Gotcha.
I'll have to do some experiments.
Hey, there we go. You can play with that a little bit.
Yep.
So when you look at omega-3, 6, 9, so on and so forth, how does an individual know where they're kind of at in regards to what should they take when you're looking at, omega-3s or just omegas in general?
So if you have access to the means to actually test your omega fatty acid levels, there are tests available. So some of the patients that I treat are more along the biohacker, want to do all the labs. They will actually measure their omega fatty acid levels to make sure that they're keeping their 3, 6s, and 9s where they want them to be. Most people just are going to take a serving size of a high quality fish oil supplement like Orthomolecular has a great one, and that should give you the proper balance.
And after the show too, I know a lot of people are going to have different questions like, what did she say again? I'll make sure that whatever products that she's also recommending for certain vitamins too, that I'll post those on Facebook, so then you can kind of circle back, because I know there's a lot of information, or people might be writing or just trying to listen like, oh, I should have grabbed that information. Yep. So when we look at all of the different vitamins and minerals, let's list the top ones that most people are probably going to circle back to. I know you said vitamin D.
Yeah.
And then what were the other components that you thought of?
I would say
salt,
vitamin D and salt, and then a good quality methylated B complex. And that's what most people would feel pretty good with, and it would have a decent amount of positive impact for the cost and inconvenience of taking something every day.
Awesome. So if you had questions on supplementation, clearly she is answering a lot of them today, which is great. But when we come back, we're going to talk a little bit more there. I know there's a North Dakota bill that was defeated, but we're going to talk also in regards to health. So circle back here shortly on Define the Fight. Hey, welcome back to Define the Fight. We're talking vitamins, we're talking supplements, and Dr. Lovat was telling me a brief story. I want to hear the whole thing. We came out of commercial break pretty quick, so I want to talk about, we were talking about vitamins, but you also had mentioned that there was a doctor that ended up getting reprimanded in regards to prescribing vitamin D. Now, that really makes a person start to question what in the heck is going on. So let's dive right into that story.
So he was a physician in Canada working in the ER, and during COVID-19, he was found guilty of prescribing vitamin D to COVID-19 patients because it went against the narrative and it wasn't a quote-unquote FDA-approved treatment for COVID, even though now we have hundreds of manuscripts, peer-reviewed articles that demonstrate that low vitamin D was one of the huge predictors of COVID-19 mortality. And it's because he went against the narrative.
Well, there was a lot of different things too, so I know ivermectin was a big buzz. Don't take ivermectin, and people were going after people like, this is what you give your cows, this is what you give your horses. And people were buying it literally in flocks, along with, was it hydrochloroquine?
Hydroxychloroquine.
Hydroxychloroquine, yeah. So, what have they found in some of those studies?
There's been a lot of positive studies for those drugs. And, but what you have to understand is we understand big pharma. There's also big literature. So the people that own the people that decide what gets published and what gets retracted. So now there's going back and retracting some of these studies, not based on the study's validity, but on other factors that they can use to retract them.
Which is crazy, and which kind of leading into, you had spoke about wanting to discuss the North Dakota bill that was defeated in the House. Let's break down first, what was that bill? And then what are the concerns that stem from that?
So your listeners will want to know that the North Dakota Board of Medicine is essentially untethered from rules and processes that all of us are bound by because they're part of an administrative law monstrosity that they brag is above the law. So they just sent out a newsletter this month posting that they defeated a bill that our state senators unanimously passed that would require them to be bound by administrative law judges' decisions, where the judge would find the board had either acted illegally or inappropriately. So the bill was SB 2285, and it was defeated in the House 31-57, despite, again, being unanimously passed in the Senate. So your representatives, like Senator Claire Corey, were just trying to get the finger off the scale of justice so that it could be applied evenly. Yet the board bragged in their newsletter that the judges don't know medicine, and therefore can't oversee the Board of Medicine. They're misrepresenting the bill because our legislators were just trying to make them accountable. So the issue isn't medicine, it's whether or not, one, did the board break the law, or did they, two, exceed the scope of their authority?
So break that down in regards to an example, because you know what? It's in layman terms, and when you start looking at that, some people are like, okay, so what exactly do you mean? So provide an example so that people have clarity on, okay, hold on, it was defeated. Is this a good thing? Is it a bad thing?
Because it was defeated, it means that, so I'll give you an example. This isn't medical advice, but let's say we have a hypothetical doctor named Dr. Smith, who has been informed by evidence-based medicine, i.e. read it in papers, that if you get into the direct sunlight for 5 minutes a day, your immune function goes up and your quality of life improves. So there's no documented study of harm in 5 minutes of sunlight exposure. So he's like, well, I want to be a good doctor. So he starts to recommend that his patients get 5 minutes of sunlight a day.
Which people should be getting is sunlight.
And keep in mind, though, there's no guidelines that say he should make these recommendations.
Right.
And sunlight is not patentable. And so no one's making money off of sunlight. So
Correct.
It's not in the guidelines. So his patients start to feel better, and some of them don't need antibiotics anymore when they get sick, which another doctor sees what he's doing and they think, well, that's wrong. He's recommending sunlight. That's unsupported. And there's probably a risk of skin cancer. So we're going to report him to the medical board. So once that happens, the door is opened for the board to scrutinize Dr. Smith's entire practice, his whole patient panel, all of his patients. The board is allowed to read any charts in Dr. Smith's practice, whether or not the patient wants them read or not.
So basically they're violating HIPAA.
Correct. They're allowed to, though, because they have that power. Invading his patient's privacy. They can make Dr. Smith undergo physical, cognitive, and psychiatric evaluations, as well as substance abuse testing, even though Dr. Smith is healthy, has no history of that, no concern for that. They're allowed to do that. The testing is going to be at his cost and starts at $20,000.
Wow.
Then the board can have, quote, experts decide if his recommendation was meeting a standard of care. They can choose whatever experts they want. They don't have to share the expert opinions with Dr. Smith. And then the experts can say that there's no evidence to support the use of the sunlight for any health benefits, despite there being hundreds of papers. They can just say there's no evidence empirically. And then even if Dr. Smith's care and documentation were excellent, they can choose to impose discipline, limit his practice. They can coerce him with a stipulation that he's no longer allowed to recommend 5 minutes of sunlight to his patients. even though it's that benign of a treatment, and even though the medical literature supports him. And if he protests, he can go to that administrative board hearing presided over by that administrative law judge. And if that judge decided that the board violated its administrative authority to investigate or didn't meet its evidentiary duty to determine discipline, the board can take that judgment, throw it in the trash, and do what they wanted to do anyways.
Wow.
That's what this bill would have stopped that from happening. And now it's been defeated, so this can continue to happen. And then Dr. Smith has to pay the board for all the costs associated with his prosecution and investigation.
So basically what you're saying is doctors, when they're trying to do seek holistic practices and show benefits of how we can heal from Mother Nature,
Correct.
right? And adding that into as a prescription, that they're basically, their hands are tied because they're not reaping any other benefits from that doctor because they're not prescribing something,
Yep.
technically.
Yep, technically. And this has a ripple effect because it can severely limit Dr. Smith's ability to practice medicine at all. Because once he has that discipline, even though it was for sunlight, he's considered a restricted provider. So Medicare and Medicaid won't pay him. So he can't work for anybody.
Wow.
So it's basically the Board of Medicine locks Dr. Smith in the room with a hungry lion, but it's not their fault that the lion eats the doctor. That's their argument. It's like, we're not CMS. That's CMS doing that. But it's what they're doing, though, because of how they're behaving. Mm-hmm. And then the legal atmosphere in North Dakota is not even to fight the board because the courts always defer to the board's decision for most things. So it's like for a judge to determine that the board acted illegally or inappropriately, it has to be pretty egregious.
So when you look at some of this, if a doctor is in competition with another doctor,
Mm-hmm.
then they can bring forth and actually have that individual, investigated for something as small as sunlight.
Yeah, anything.
That's crazy.
And the board has the ability to decide what they will and will not investigate. So let's say you work at a big health system.
Yep.
And you get reported for overprescribing pain medications. Usually that health system has a contact somewhere that they can keep this all under wraps for you. But if you're independent, you don't have that number.
You don't have that umbrella.
Mm-mm.
And it's crazy when you say that because there are some people that overprescribe certain things that are damaging to individuals' health.
Yep.
But then when you have individuals who are trying to make sure that they're prescribing something that is free,
Right.
then there's a problem. That doesn't make sense to me. And that's why when we start looking at different things and deciphering through the industry, you have some amazing doctors. So I'm not scrutinizing people. Okay. I just want to throw that out there. I've seen amazing doctors that see both sides, right? Like in some cases, there's prescriptions that are required. In other cases, clearly they are not. But what I define, my personal definition of a great doctor is an individual who is actively seeking holistic approaches without pushing somebody directly onto a medication on, hey, if you work on reducing your stress, these numbers will go down. Your hydration levels, so on and so forth. That's what I'm looking for. Or somebody who will do a little bit deeper dive, like, okay, I haven't seen this before. Let me do more research instead of saying, okay, well, this could fall underneath this.
Right.
But the reality is it might not be that. So don't medicate me for that unless you know exactly what it is. What is the underlying seed of the problem?
Mm-hmm. Yeah, no, we jump right on prescriptions. And I mean, all of these psychiatric drugs are not necessarily approved in the populations we use them in and haven't necessarily been well tested. And so, but you would never get into any controversy for giving someone Prozac. But vitamin D is controversial. It's very strange.
It's very odd because then you start looking at, let's just use Prozac for an example. What are the adverse effects?
Increased risk of suicidal ideation.
And again, people aren't looking at some of those things. Okay, so this person might have suicidal thoughts or take it to the actual extreme. I would question that, right? Same with, I was talking earlier this morning as my mom was diagnosed with Parkinson's. And the doctor had said, I suggest you take this prescription. And then when I'm actually reading the verbiage stating, this will not slow down the rate. This may help with symptoms, but will not reduce them. Right? In so many words, it's not going to do anything for the most part, right? And then I read through and I sat down with her and I said, okay, let's go through the adverse effects, Mom. And the adverse effects were hallucinations, right? Suicidal thoughts, impaired sleep, so on and so forth. I'm like, Mom, So it's basically saying right here that it's not going to help slow down, prevent, all of those different components. But now on the backswing, these are the things that might come into effect. So risk reward, what does that look like to you? And clearly at that point, she's like, yeah, I don't know why that they would even send this home with me. It just doesn't make sense. But not everybody has an advocate.
Well, also billing wise, if you leave with a prescription, you have a higher coded visit than if you leave with no prescription.
And that goes back to the quality metrics.
Mm-hmm.
So we do need to, as individuals, when we look at health, really truly define what that is. And if you're not sure on something, get educated on it. Find an expert in that area. Be cautious, again, in regards to who you're seeing. But I know that if people had questions too for you, that you would be, again, you shared some information for me too. So if people have questions, let me know. And I can also reach out to Dr. Lovat to make sure that we can get some insight for you. But we're going to go into a quick break. And when we come back, I want to recap some of the vitamins, some of the minerals, and then any other components that you want to add in. So we'll be back here shortly on Define the Fight. Hey, welcome back to Define the Fight. Wow is all I can say. So when you start looking at bills that are passed, I know personally, when we're going through voting time, there's a lot of questions like, okay, so if I vote yes for this, does it mean this? If I vote no for this, does it mean this, right? So it comes down to the verbiage and sometimes just breaking it down. But that's a powerful thing. And now waiting until 2027 to have that reviewed again, that's a scary thought.
Yeah, I mean, and it's been going on for a long time. The fact that the bill passed the Senate with such an overwhelming majority, bipartisan, is very positive. I think individuals who care about this issue should see who their House representative is and see how they voted on this bill. And if they voted the wrong way, they need to contact them.
Well, and the thing is, too, is like have an active conversation. And did they actually understand what they were doing? Because, I'm just playing like the devil's advocate. Some people aren't going to know.
Mm-mm.
They're not. But sometimes when trying to pass a new bill, I'm going to just say no. Or you've got no people and you've got yes people, right, until it's truly defined. I want to do a recap in regards to the minerals and the supplementation. Let's break that down really quick too so people can take some notes. So when you're looking at vitamin D, you want to make sure that that is also with K2, correct?
Yes.
And why is that a significant importance?
Bone health and reduced calcification in the vascular system because the calcium is being drawn into the bone.
And then when we spoke about magnesium, there's two different components that you had mentioned. One was more so for thyroid, and then the other was for more of bowel, GI, being able to make sure that you're flushing your system.
Yeah, magnesium citrate and other magnesiums would be more for gut motility and constipation. Magnesium glycinates, whichever glycinate form they have, is usually meant for blood sugars and hormone pathway support.
Are you going to see that more utilized in women than in men? I suppose it all depends on, too, if somebody is, depending on their insulin. But, too, men's hormones, too, go out of whack, too. So I'm assuming then it's for both individuals.
Mm-hmm.
Looking at the salt, breaking down the salt, what is the recommended intake a day for individuals?
It depends somewhat on your size. So like a 150-pound woman could probably do a teaspoon of Celtic sea salt and 8 ounces of water in the morning, first thing. A bigger guy might do 2 or 3 and maybe 16 ounces of water. And if you have hypertension or high blood pressure, or you're on any heart failure drugs, you would need to talk to your provider before you would introduce salt supplementation, because in those individuals, they're usually on drugs that affect their electrolyte balance.
Perfect. And then again, circling into the calcium, you had 2 different breakdowns in regards to the calcium. So looking at the carbonate and the citrate, you were saying that the citrate is more absorbable or
citrate works any time of the day. It's not dependent on the acidity of the stomach. So if you're on a stomach medication, that's the one that you would probably use. And carbonate is more with meals when you have the ability to secrete normal amount of stomach acid.
And then for the omegas, the 3, 6, and the 9, you had mentioned a certain brand that you would recommend that was highly absorbable. What was that brand?
Orthomolecular's omega fish oil.
Orthomoleculars. And then is there any other supplementation or minerals, vitamins and minerals that you would recommend?
Methylated B vitamins are usually a good idea. And I will say that usually they'll have thiamine in there, which is what turns your urine bright yellow. It doesn't mean that you didn't absorb it. It's just an artifact of taking thiamine. Like banana bags at an IV, they're bright yellow. It's the color of the vitamin.
So question in regards to methane blue. What are your thoughts on that? Because, you talk about the yellow urine. I have taken methane blue, and it is, your urine is aqua, baby.
Is it? There's a lot of buzz on it right now. I'm not convinced necessarily that it's a good idea. There could be some mitochondrial, negative mitochondrial impact from taking it, and it might work in individuals that have damaged mitochondria to begin with. So I'm not sold on it quite yet. I need to do more reading.
Okay, perfect.
Yeah.
Any other advice that you would suggest to individuals? I know, the key thing is when you're taking supplementation, don't just take things to take them. I think that's a big thing. It's like, oh, well, my friend Susie down the road is taking it and she's seeing results. Well, then I'm going to see it too. It's the same thing when it comes to fitness. Oh, so-and-so lost weight doing this, so then I'm going to start jumping on that bandwagon. What are your recommendations? And I know clearly blood work is probably going to be one of them.
Yeah, blood work, and also you should be working with an individual that can tell you, make a plan. What's your goals for your quality of life or your health care? And those goals should dictate what supplementation you're going to use, in addition to what if you use medications or hormones with that. And blood work helps you guide that, as well as symptoms. So, for example, if you are low in zinc, you can get perioral dermatitis. You can get a rash and cracks at the corner of your mouth. I've seen that in a number of individuals. If you're iron deficient, you could be craving ice or dirt. And so there's other things in your history that might indicate you need more of a certain supplement than others.
How many people need zinc, would you say, are lower on the zinc end?
So men, generally, you can take zinc every day. It helps with testosterone signaling, and it's good for your immune system. In women, there's a greater chance there's a zinc copper transporter that you can end up excreting too much copper if you're taking too much zinc. Gotcha. So it's more of a balance there.
Perfect. So how can individuals learn more about your facility and how to clearly look you up to learn more information?
So the website's probably the best, fireflymedical.net. We do have a news tab where we have all of our podcasts whenever we go on anywhere. We're also going to be launching our podcast next month called The Balanced Dose.
Nice.
And that'll be on Spotify and Apple. And our plan is the first episode to be June 17th.
Beautiful. And what are some of the services that you guys do at Firefly Medical?
We do medical weight loss, bioidentical hormone replacement therapy, and we also do aesthetics. So neuromodulators like Xeomin instead of Botox. We do some filler. We do facials, and we do a lot of IV vitamins and intramuscular vitamins.
Beautiful. Well, I appreciate clearly all of your knowledge, your time, because I know that you're not in Fargo. I mean, sometimes you're here, but for the most part, coming from Grand Forks. And you have different locations. So where are all of your locations?
We have a location in Liberty Lake, Washington, Grand Forks, North Dakota, and Fargo, North Dakota.
Perfect. So, I mean, most people listening probably aren't in the Washington area, but you know what? If you've got friends out there, make sure that you share. Mm-hmm. So again, one more time, what is your website?
Fireflymedical.net.
Again, so if you guys are looking for blood work, hormones, so many different components, make sure that you guys reach out to Firefly Medical. Dr. Lovat is an amazing individual, and clearly she dives deep into to research, and that's really what it's all about. You want your provider to make sure that they are looking out for your best interests. So until we see you guys next week, make sure that you are looking at, hey, what am I currently taking right now? Why am I taking it? And if you're not quite sure why you're taking it, get that blood work done to see where you're deficient. So until we see you next week, get out there and define your fight.